Have you ever thought that the way you sleep at night could quietly influence your brain and heart health? It's not just a dramatic idea. Recent studies suggest that a significant portion of strokes and circulatory events happen during the night or shortly after waking. This doesn't necessarily relate to stress, cholesterol, or medications, but rather to subtle, everyday habits while sleeping. For example, I recently cared for a 68-year-old patient who was otherwise active, ate well, and had normal cholesterol. Yet he experienced a sudden stroke shortly after waking. It wasn't a single lifestyle factor or genetic risk that caused it. The issue was linked to his sleep position combined with other nighttime habits. Sleep is often overlooked as a health factor, yet it can quietly influence circulation, oxygen delivery, and even long-term brain health. Understanding the nighttime risks. Many people assume strokes or circulatory events occur only during stressful situations, but in reality, our circulatory system becomes more vulnerable with age. Around age 50, blood tends to thicken slightly, and minor shifts in blood pressure or posture can place additional strain on the heart and brain. During sleep, our bodies should be in a state of recovery, but subtle changes, like the angle of our head, how we position our neck, or even which side we lie on, can significantly affect blood flow. Even small, consistent habits can either support vascular health or quietly increase stress on fragile blood vessels. Awareness of these factors is the first step to creating safer, more restorative sleep routines. Dangerous sleep habit number 1, sleeping flat on your back. One common habit many older adults practice is sleeping completely flat on their back without a pillow. While this may feel neutral or even beneficial for spinal alignment, for some adults it can elevate risks for circulation issues. When your head lies level with the heart, gravity affects blood return from the upper body, which can raise pressure in delicate brain vessels and reduce oxygen flow. Some people may wake with headaches, dizziness, or blurred vision without realizing these are related to sleep posture rather than stress. Adjusting the head angle slightly, around 15 to 30 degrees above the heart, can improve circulation without straining the neck. Medium-height memory foam pillows or an adjustable bed that lifts the upper body can help relieve pressure, enhance breathing, and lower nighttime blood pressure fluctuations. This small change can make sleep safer and more restorative. Dangerous sleep habit number 2, sleeping on the right side. Side sleeping may feel natural, but the specific side you lie on can affect circulation and heart function. The heart tilts slightly to the left in the chest, and when you sleep on your right side, the inferior vena cava, the large vein returning blood from the lower body to the heart, can become slightly compressed. This makes the heart work harder to maintain efficient blood flow. For most healthy individuals, this isn't a problem, but for those with high blood pressure, heart conditions, or occasional nighttime chest discomfort, sleeping on the right side may subtly stress the cardiovascular system. Left side sleeping, in contrast, allows the heart more space to pump efficiently and improves venous return, which supports better circulation overnight. Using a body pillow can help keep your spine aligned and prevent unintentional rolling onto the right side, making this adjustment simple and effective. Dangerous sleep habit number 3, using too many pillows. Many people overcompensate by stacking 2 or 3 pillows to ease acid reflux or support the head, especially as we age. However, over-elevating the head can bend the neck unnaturally, compressing blood vessels that supply the brain, including the vertebral arteries. While the effects may not be immediately noticeable, chronic improper alignment can contribute to tension headaches, neck stiffness, and reduced blood flow over time. Adjusting to a single pillow with low to medium height, particularly memory foam that supports the natural neck curve, can improve circulation, reduce morning discomfort, and support overall brain and cardiovascular health. If elevation is necessary for acid reflux or snoring, using a wedge or adjustable bed ensures the head and upper body are lifted evenly without creating awkward neck angles. Dangerous sleep habit number 4. Sleeping in a tightly curled fetal position. Many people favor the fetal position for comfort, curling their legs up toward the chest with the chin tucked. While comforting, this posture compresses the chest and limits lung expansion, leading to shallower breathing. For older adults, or those with underlying heart or lung conditions, this can subtly reduce oxygenation during the night. Additionally, curling tightly places tension on the neck, shoulders, and upper back, potentially compressing small vessels that support brain circulation. People may notice dull headaches, neck stiffness, or morning fatigue without connecting these to sleep posture. Gentle adjustments, like straightening the legs slightly, keeping the spine more neutral, and using a pillow between knees and arms, can maintain comfort while promoting safer breathing and circulation. Small changes like these can improve oxygen delivery to the brain and heart and enhance overall sleep quality. Dangerous sleep habit number 5, going to bed right after eating or drinking alcohol. Eating a large meal or consuming alcohol immediately before bed can subtly impact circulation, especially in older adults. After a meal, blood is redirected toward digestion, which slightly reduces circulation to other parts of the body, including the brain. Alcohol further complicates matters by dilating blood vessels, sometimes lowering blood pressure and then triggering compensatory spikes. These changes, while minor in young adults, can influence blood flow in older adults with narrower arteries or cardiovascular vulnerabilities. Simple adjustments, finishing dinner at least 3 hours before bed, limiting alcohol several hours before sleep, and taking a short post-dinner walk, can enhance circulation, aid digestion, and support deeper, safer sleep. Best sleep positions for brain and heart health. Now that we've explored habits that can strain circulation, let's focus on the positions that support overall health. Left side sleeping is widely recognized as optimal for heart and brain function. The left side reduces pressure on the heart, improves blood flow through the veins, and even supports the brain's glymphatic system, which clears metabolic waste while you sleep. This cleaning process, vital for cognitive health, works more efficiently on the left side, potentially reducing the accumulation of compounds associated with neurodegenerative conditions. Left side sleeping also helps with acid reflux by keeping the stomach above the esophagus, improving comfort and supporting uninterrupted sleep. If left side sleeping is uncomfortable due to joint pain or shoulder issues, sleeping on your back with slight elevation is another excellent option. Elevating the upper body about 15 to 30 degrees supports circulation, reduces pressure on blood vessels, and maintains a neutral spine. Slightly elevating the knees can further relieve lower back tension and promote more even blood flow throughout the body. For individuals with mild sleep apnea, back sleeping with elevation can improve breathing, while for those with heart or shoulder issues, side sleeping may remain preferable. The key is to find a position that balances comfort with cardiovascular and neurological support. Creating a sleep-friendly environment, sleep, is about far more than just duration or comfort. The environment in which you rest plays a critical role in supporting cardiovascular, neurological, and overall health. The first key factor is temperature. Your body naturally lowers its core temperature as part of the sleep process, which signals that it's time to enter restorative stages. Keeping your bedroom between 18 and 20 degrees C creates the ideal environment for this natural cooling, helping you achieve deeper sleep and stabilizing blood pressure fluctuations that can otherwise place stress on the heart and fragile blood vessels. Equally important is lighting. Exposure to blue light from screens, TVs, or even bright overhead lamps suppresses melatonin production, the hormone responsible for signaling sleep. By avoiding these sources after 9 p.m., you allow your body to enter natural circadian rhythms, improving the quality of deep sleep, which is essential for heart function, brain detoxification, and hormone regulation. Sound is another often overlooked factor. Even subtle noises can interrupt sleep cycles, triggering micro-awakenings that elevate heart rate and stress hormone levels, quietly straining the cardiovascular system. Using earplugs, white noise machines, or soft ambient sounds can help maintain uninterrupted sleep, supporting overall circulation and neurological health. Proper bedding and neck support also make a significant difference. A memory foam pillow or a cervical contour pillow helps maintain the natural curve of the neck and spinal alignment, preventing compression of blood vessels that supply the brain, improving oxygen flow, and reducing morning stiffness or headaches. Optimizing these environmental factors is not about perfection. Small, consistent changes make sleep more restorative, safer, and more rejuvenating for both the heart and the brain. Tracking sleep and circulation. Beyond creating the right sleep environment, monitoring how your body responds at night can offer powerful insights into your overall health. Modern technology makes it easier than ever to track subtle circulatory and neurological signals while you sleep. Overnight pulse oximeters, for example, measure oxygen saturation levels in the blood, alerting you to potential issues like sleep apnea or episodes of reduced oxygenation that could strain the heart and brain. Heart rate variability, or HRV, is another key metric. Measured using a smartwatch, fitness tracker, or sleep ring, HRV reflects the balance of your autonomic nervous system and indicates how well your body is recovering overnight. Lower HRV may suggest inflammation, high blood pressure, or metabolic stress, providing an early warning to adjust sleep or lifestyle habits before complications arise. Keeping a simple sleep journal complements this technology, recording how you feel each morning, energy levels, mental clarity, presence of headaches, dizziness, or unusual fatigue can reveal patterns that indicate subtle circulatory or neurological stress during the night. Together, these tools create a feedback loop that empowers you to take small, effective actions to improve sleep, enhance blood flow, and protect overall cardiovascular and cognitive function. The power of small changes. One of the most important lessons about sleep is that small adjustments often create the largest long-term benefits. Many people assume that sleep quality is only about the number of hours they spend in bed, but posture, environment, and lifestyle timing are equally important. Slightly adjusting the angle of your head while sleeping can reduce pressure on blood vessels and improve venous return to the heart, supporting better oxygen delivery to the brain. Choosing the correct side to sleep on, preferably the left, can reduce strain on the heart and improve circulation through the large veins. while minor modifications like straightening the legs in a fetal position or supporting the neck properly can prevent compression of critical blood vessels. Timing is also a key factor. Finishing meals several hours before bed and avoiding alcohol close to sleep helps the body maintain stable blood flow and reduces nighttime circulatory fluctuations. Individually, each of these habits may feel minor, but combined, they support long-term cardiovascular stability, enhance oxygenation, and reduce strain on fragile brain vessels. Over time, these small adjustments protect cognitive function, maintain vascular health, and contribute to a greater sense of energy and well-being during the day. Better sleep doesn't just improve mornings. It strengthens your body's natural repair systems, supports hormone balance, and promotes a healthier cardiovascular system over the long term. Recommended sleep practices. Putting these principles into action is simpler than many people realize. Aim to sleep on your left side whenever possible, as this position encourages optimal circulation, supports heart function, and enhances the brain's natural waste-clearing system. If back sleeping feels more comfortable, elevate your upper body gently by about 15 to 30 degrees to reduce pressure on the heart, improve breathing, and maintain proper spinal alignment. Use a single supportive pillow rather than stacking multiple pillows to avoid compressing neck vessels, and avoid excessively curling into a tight fetal position. Keeping the spine in a more neutral alignment ensures better oxygen delivery and circulation. Finish dinner at least 3 hours before bedtime, and limit alcohol consumption in the evening to allow the body time to stabilize blood pressure and digestion. A gentle walk after dinner can promote circulation and support healthy metabolic rhythms. Optimize your bedroom by keeping it cool, dark, and quiet, and reduce exposure to blue light from phones or screens in the hour before bed. Finally, track sleep patterns using a simple journal, pulse oximeter, or HRV monitoring device to gain insight into oxygen levels, heart rate patterns, and overall recovery. These small, actionable steps empower you to create a sleep routine that protects your brain and heart while enhancing daily energy and focus. Final thoughts. Sleep is a remarkable time for restoration, repair, and overall health maintenance, yet it is often undervalued in discussions about longevity and vitality. By being mindful of posture, timing, and environment, and making simple, consistent adjustments, you can dramatically improve circulation, oxygen delivery, and vascular stability overnight. Even small changes, like elevating your head slightly, sleeping on your left side, finishing meals earlier, or reducing nighttime noise, can have a profound cumulative effect over months and years. Tracking how your body responds at night provides valuable insight and allows you to fine-tune your habits for maximum benefit. These small, thoughtful interventions not only support your cardiovascular and neurological health, but also help maintain cognitive function, balance hormones, and enhance your overall sense of energy and well-being. Start with one adjustment tonight. Observe how it feels, and gradually incorporate other changes. Over time, these mindful habits can create a safer, more restorative sleep routine, leaving your body rejuvenated, your mind clearer, and your heart and brain supported for years to come. Sleep well, and your body will thank you with better health, vitality, and clarity each morning.